So, Dr. Edwards, explain a little bit about sort of the growth you've had. You have a vein clinic, and you've gotten into kind of a very specialized little niche. How did you kind of get from your early days of medicine into something that has grown into quite a impressive enterprise?
Well, I'm a vascular surgeon trained, and vascular surgeons deal with arteries and veins everywhere but the heart. And we were treating veins before we opened up our specialized vein clinic with what was in the past the standard of care, which was vein stripping. 10 years ago or so, some people figured out that you could do something else to the vein besides tear it out. And laser ablation and radiofrequency ablation became popular, and we adopted.
So explain how that works. What do you do when you go in and do those kinds of treatments?
So essentially, it converted a in-hospital or a medical outpatient surgical procedure to a in-office procedure. So that was the other big jump.
So this isn't even done in a surgical center anymore?
No, it's done in our office. It jumped exponentially in technology,
right,
because we were going from an open surgery procedure in a hospital to outpatient surgery using lasers and radiofrequency ablation. So essentially the laser and the radiofrequency ablation are simply a method of delivering energy to the vein. So we cauterize it from the inside out, basically, and do that under local anesthesia. So
you basically close off that vein.
Right. So and actually, when we saw this change, we decided to have a specialized clinic in the treatment of these veins, because the number of people who were candidates for the surgery all of a sudden grew tremendously.
Oh, I'd imagine.
It's estimated that there millions of people, something like 50 million people, have varicose veins
right,
in the U.S.
Right.
and may need treatment. The Vein Center has been in operation for almost 10 years now. We're very excited about our new office that we're opening in Mount Juliet that will start in January.
At the Vein Centers, we have 4 vascular surgeons, all board certified. Between us, we've got over 100 years of experience in treating this problem, both from training and working actively with vein patients. Selecting a vein surgeon is just like selecting for any other type of major procedure. I mean, experience helps, proper training helps.
Traditionally, treatment for varicose veins was done in the hospital, and most of the treatment for varicose veins was done by vascular surgeons. The patient should be at a comprehensive vein center.
Many people present with the classic bulging ropes on their legs, and we all recognize that as varicose veins. Since we've been doing a lot more ultrasounds, we've realized that a lot of people can present more with lower leg swelling that might show up by the end of the day.
If you have spider veins and you also have varicose veins, you're going to need to get the varicose veins treated before the spider veins, or the sclerotherapy that you might be offered is not going to work.
If you let it go on, the longer you go on, the more incompetent veins you get, the larger the varicoses, and the more things you'll have to deal with in getting the final treatment.
I think it is absolutely important and crucial that your provider be someone who has the knowledge and expertise of having taken care of varicose veins for a number of years.